Hi, I'm Lori Butterworth. I'm the CEO at AIM Youth Mental Health. And like so many of us, we at AIM have been deeply reflecting on the impact that the COVID-19 pandemic has had on our youth. And as many of you know, the US Surgeon General just released a report called Protecting Youth Mental Health. And this lays out an outline of recommendations, strategies, metrics, and resources that we can use collectively as a nation to address the burgeoning youth mental health crisis. So today, what I'd like to do is share with you AIM's response to some of the key recommendations in the report. And this is the Surgeon General's report. It's a call to action. And it actually could not be timelier because we're just getting data from 2020, collecting data on the impact of COVID on youth. And, suicide is the second leading cause of death in teens. That is second only to accidents. 30% of teen girls suffer from anxiety. And during the pandemic and the 2020 statistics, more than 14% of our youth have had a major depressive episode. And this is very concerning because we know that the first onset of a depressive episode raises the likelihood of an individual suffering from depression throughout the lifespan. And the sad part of this is 60% of those teens did not receive treatment. We know that 75% of mental health problems start before age 25. So we at AIM know that a swift strategic response, and we need to respond now. We need to respond now to the mental health crisis because, it's not only our responsibility, we believe it's our moral imperative. And you think about when COVID started, youth and children isolated in order to protect the vulnerable, the elderly and medically fragile of the population. They gave up so many of those milestones of growing up. They missed school, they missed being with their friends, so many of what makes a rich experience in youth toward a healthy outcome in adulthood. So they've given that up. So that's why we're so committed to addressing this issue now, because we believe, like I said, it's our moral imperative. So therefore, we are building and expanding our efforts to protect and improve the mental health of youth. And we're doing this by aligning our research investments and our investments in programs with key metrics and recommendations outlined in the report. And at the same time, working with aligned youth mental health organizations, grant recipients, and funding partners to strategically unite and coordinate our efforts. We believe that if we can bring communities together in a coordinated effort, we will have exponential impact. So here are some of the recommendations I'm going to talk about first. First, to invest in innovative approaches to research on mental health, conduct research to expand our understanding of social media and digital technology and what the impact is on youth mental health, and then to identify opportunities for intervention, and also to create sustained investments in equitable prevention, promotion, and early intervention. So to date, AIM has invested nearly $4 million in innovative approaches to address this escalating youth mental health crisis. And more than 2,100 teens, children, teens, and young adults have received cutting-edge, innovative treatments by participating in clinical trials and youth mental health programs funded by AIM. So I'd like to talk about this body of research that we've already invested in that is now ready for implementation. So as I describe this, think about this as a set of collective knowledge. So we're looking at understanding how stress causes anxiety and depression, how to assess severe irritability and mood dysregulation in children, and how to address aggressive, disruptive behavior. We have a study going on where it combines peer mentorship and technology to intervene as an intervention for anxiety. And using smartphone technology, we have several studies that study smartphone technology to prevent and address anxiety, depression, eating disorders, suicidality, and to help children with ADHD. We're looking at understanding, the study that we're looking at is looking at eating disorders in Black and Latinx youth, but also looking at healthcare access barriers that and try to how we can break down those access barriers with underserved youth. Mindfulness tools. We have a study going on with mindfulness tools to help youth with learning difficulties, with learning differences, and we know the anxiety that happens in school for children with learning differences. So we have these mindfulness tools that we're investing in to help them with attention. We're finding that it improves attention and reading skills. We're looking at understanding the predictors of suicide. Again, that early intervention, and also early intervention with clinically anxious preschoolers. Those preschoolers who just have that crippling anxiety, we're finding that if we can intervene early, then we're going to reduce the likelihood of anxiety later in life. Also, we're looking at early intervention for children who are at high risk for developing serious mental illness. And we're talking about intervening, again, early, sometimes before the manifestation of serious mental illness. If we can intervene and address and treat then, again, you're going to see a more likelihood of successful outcomes and higher quality of life throughout the entire lifespan. So recommendations to implement evidence-based programs that promote healthy development, support children, youth, and their families, and increase their resilience. Like I just said, we're looking at this body of knowledge, this funded research that we're ready to implement these evidence-based programs and practices. Another recommendation is to ensure that the programs rigorously evaluate. We have evaluation metrics at AIM worked into our strategies. And to scale up evidence-based interventions, technologies, and services, thinking back on the body of knowledge that I just talked about, we're ready to scale these evidence-based interventions, scale them up. We have at AIM a diverse group of the most distinguished and progressive research doctors in the global pediatric mental health community. And they serve on the AIM Scientific Advisory Board. The Scientific Advisory Board, they not only help us strategize the most effective ways to fund cutting-edge research in youth mental health, this group also develops models for training clinicians to deliver the best treatments to the front lines where children are being treated. The AIM Scientific Symposium, it's an in-person and live-streamed conference, and it bringing together a diverse group of experts. And we at AIM define experts, of course, our Scientific Advisory Board and other mental health researchers are considered experts, but we also honor the expertise of youth and parents, teachers, mental health clinicians, policymakers, all of some of the most respected people, all coming together to learn and plan the best strategies to protect the mental health of youth in the wake of this pandemic. So our strategy at AIM is to find, fund, evaluate, and implement evidence-based youth mental health solutions. And we know that by doing that, we will have the greatest impact. So now with this significant body of research funded and conducted through our investments, we at AIM are uniquely positioned to disseminate and implement these treatments where and when youth need it. So another recommendation by the Surgeon General is to empower youth and their families to recognize, manage, and learn from difficult emotions. We have a partnership with Mental Health Connect, and with Mental Health Connect, we are training parents, teens, first responders, healthcare providers. We're training key messengers within the community in mental health first aid. And this program, we're piloting this program in the Monterey Bay area and then preparing for broad expansion. So the goal is to create a safety net in a community of support. Now, we know that there is a dearth of clinicians able to treat kids right now. So what we can do, though, is train in mental health first aid, very similar to how you would get CPR training and certification. We are certifying groups of people within communities in mental health first aid. And this program is an international education program. It trains the participants to recognize and respond to signs and symptoms of mental health and substance use challenges. Another recommendation by the Surgeon General is to elevate the voices of children, young people, and their families. Our Ideas Lab, the AIM Ideas Lab, it's a youth participatory action research program. We have 250 participants ready to launch in the Monterey Bay area and then expanding out. And this is where youth learn to conduct their own research, their own peer-to-peer research, to discover and then recommend their own solutions to the issues that challenge them. So in this coming year, in 2022, the AIM Ideas Lab youth will also conduct a needs assessment in partnership with the Stanford Department of Psychiatry and Behavioral Health. Then Stanford has the Alcove program, which is a youth-led intervention. These are centers where they're holistic centers where youth can come and have their mental health issues addressed, but also other life challenges in a holistic model. So our youth in the AIM Ideas Lab will be assessing where and when these types of centers would be helpful for kids. Can you imagine like being part of being able to as a youth, being able to research yourself and then be part of a solution? It's very empowering. So this is an opportunity for the youth to bring their voice to the table, their voice as an expert to the table, and present their ideas, present their research and solutions. And they will do that at the scientific symposium and then at other community gatherings. Another recommendation by the Surgeon General is to educate the public on the importance of mental health, reduce negative stereotypes and all the biases and all that stigma around mental illness. Our AIM awareness and AIM for Awareness Walk and Rally. This is a mental health fair where there are community resources, communities come together, and it's an opportunity for conversations, to start the conversation. Our AIM Youth Ambassador program, this program empowers young adults, students in middle and high school to lead these community awareness programs. And also they lead their own youth empowerment initiatives. And the AIM Design Challenge is a place where youth can artistically express what mental health means to them. And this is a platform, it's a safe platform to start conversations about the importance of mental wellness. So I want to give you our strategies. This is our plan. This is what we hope to do in 2022 and beyond. In 2022, we aim to close the gap between research and access to innovative mental health solutions for children, teens, and young adults. And we're doing that by using an implementation science strategy to have the greatest impact. We're also engaging youth as experts in identifying emerging mental health challenges, finding their own solutions, and leading the efforts to forge those solutions. We're also aiming to empower parents and other significant adults to identify mental health challenges and help youth find support. And this is through our mental health first aid program. We're also looking to reduce the stigma as we raise awareness about the realities that children, teens, and young adults are facing. And we're hoping to do that in 2022 by facilitating meaningful community conversations, engagement, and education. So in closing, our nation is facing an unprecedented challenge. And there's no single solution, and it cannot be fixed overnight. It's going to take all of us. And the Surgeon General, the public recognition of the crisis is important. It's an acknowledgement of our collective responsibility to act thoughtfully, swiftly, and collaboratively. And we at AIM are stepping into the moment to do our part. We're dedicating our time, our talent, and resources to find solutions and to build a movement devoted to the mental health of children, teens, and young adults. Because as the Surgeon General said, it would be a tragedy if we beat back one public health crisis only to allow another to grow in its place. I want to thank you for taking the time to listen and learn today, because learning and knowledge is power in addressing this crisis. And I want to close with what Margaret Mead said, because we all have a part to do in this. And so Margaret Mead said, never doubt that a small group of impassioned individuals can change the world. In fact, it's the only thing that ever has. I look forward to talking, hearing from you, and working with you to improve and protect the mental health of our youth. Thank you.